Good morning, good afternoon, and good evening, ladies and gentlemen. My name is Sirait-2021 and I'm a student at LSPR Communication and Business Institute, Jakarta. As a 5th semester student, I learned many new and exciting subjects, and one of them is this subject, which is public speaking and presentation skills, with Mr. Charles Bonar Sirait as my mentor and lecturer. Ladies and gentlemen, imagine if we could go outside without a mask, we could breathe the fresh air. No more social distancing or other rules that limit us to meet the family and friends that we love. Could you imagine where we as a student could go back to school and campus, or our parents could go back to their office without a worried feeling? Well, for now, the situation is still uncertain, but I believe that together we can do something, at least starting from ourselves, to improve our body resistance. In this video, I'm going to tell you more about what public health is, why it is that important, and also I'm going to discuss about vaccination and the research progress that my team and I conducted about an analysis of the Ministry of Health of Republic of Indonesia's communication strategy in socializing COVID-19 vaccination on Instagram. So, what is public health? Public health, or good health and well-being, is the third issue out of the 17 issues of Sustainable Development Goals, or SDGs, which are responsible for ensuring healthy lives and promoting well-being at all ages that are essential to sustainable development. The World Health Organization also defines public health as the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. Based on that understanding, we can conclude that basically, public health is concerned with protecting the health of the entire population. It can be small populations like local neighborhoods until a big population as an entire country or region of the world. Public health is very important because it helps prolong the lives of people with the help of preventive measures that will keep the body healthy and fit longer. Moreover, public health is also responsible for implementing educational programs, recommending policies, administering services, and even conducting research in order to prevent disease rather than to curing them. Because as we all know, that it will be more effective and less expensive to prevent than to cure. Now, the world is facing a global health crisis, or we know as COVID-19 pandemic. This pandemic brings big impacts and changes for human life. It not only affects the human health, but also the world economy and even upending the lives of billions of people all over the world. Based on the last updated data from Worldometer on October 29, 2021, there are approximately 200 million of COVID-19 cases in the world. The data also shows the currently infected patients that reach approximately 18 million patients, where some of them are in mild condition and there are some of them who are at a serious or critical stage. In Indonesia, based on data from the World Health Organization, from 3rd January 2020 to 28 October 2021, there have been approximately 4 million confirmed cases in Indonesia with approximately 100,000 deaths. The high number of COVID-19 cases and deaths in the world, including Indonesia, made the scientists, along with the government, researchers, and volunteers work together to find a vaccine that can help to reduce the number of COVID-19 cases. In early December 2020, after going through 4 stages of testing to measure the effectiveness of safety of the vaccines, the scientists succeeded in finding vaccination to prevent the spread of COVID-19 virus, and the first mass vaccination program started. Until now, there are 13 different vaccines that have been administered, such as Sinovac, AstraZeneca, Johnson & Johnson, and many more. All of those vaccines have been distributed to all over the world, including Indonesia. And the first recipient of COVID-19 vaccine injection in Indonesia is Indonesian President Mr. Joko Widodo. That moment also marks the beginning of the first stage of COVID-19 vaccination process in Indonesia. The Ministry of Health of the Republic of Indonesia is the front line of this COVID-19 pandemic, which is responsible for everything related to COVID-19, including the vaccination. Therefore, in order to distribute the vaccine, the Ministry of Health of the Republic of Indonesia does socialization. And one of the ways of socialization is through their Instagram account. And this is what my team and I conduct research for, which is to know the Ministry of Health of the Republic of Indonesia's communication strategy in socializing COVID-19 vaccination on their Instagram account. We collect the data with in-depth text analysis from the Ministry of Health Instagram account, such as from their posts and the comment section. The result is still ongoing, and I hope that I could give you more updated information on the upcoming video. Together we can. Together we survive, because it all starts from us. Let's stop the spread of COVID-19 virus by obeying the government policies and receiving vaccinations. My name is Sirait-2021. Thank you for your time and attention. See you on the upcoming videos.